My Lords, I beg leave to ask the question standing in my name on the order paper.
On the 27th of July, the Government published an initial response to Dame Carol Black's review, welcoming all 32 recommendations and setting out a clear cross-government commitment to the agenda. The Government is also committed to respond to Dame Carol Black's review in full by the end of the year, and to set out a long-term drug strategy in which the Government will present our whole-of-government response to drive down drug supply and demand.
Moylan.
My Lords, may I also welcome my noble friend to his place on the front bench. My Lords, with entrenched drug use driving half of the nation's crimes and people with serious drug addiction occupying 1 in 3 prison places, does my noble friend accept Dame Carol Black's finding that the public provision we currently have for drug misuse prevention, treatment and recovery is not fit for purpose, and that Her Majesty's Government faces an unavoidable choice: invest in tackling the problem or keep paying for the consequences?
Well, can I thank my noble friend for the question and the point he made so fiercely. In January, the government announced a £148 million crime package for 21 to 22, which has been allocated to local authorities for drug treatment and recovery services, focused on improving services for offenders and reducing deaths. This is the largest increase in drug treatment funding for 15 years.
My Lords, we have a very good example inside the UK of the short-term impact of cutbacks in rehabilitation and treatment, where in Scotland we now have the highest level of drug-related deaths in Europe, partly as a result of cutbacks in treatment and rehabilitation in the course of the past decade by the Scottish Government. Well, the UK Government, who share some responsibilities with the Scottish Government for drug policy under the devolution settlement, will the UK Government guarantee to work with the Scottish Government to try and turn round this devastating situation?
Well, on September 2020, Kit Malthouse and Joe Churchill, the then Minister for Prevention, Public Health and Primary Care, co-chaired a UK drugs ministerial focusing on UK-wide approaches to misuse. The second UK drugs ministerial actually took place at Hillsborough Castle in Belfast on the 11th of October. This government maintains a commitment to consulting the devolved administrations or devolved governments in many cases, as well as a number of expert speakers.
Your contribution, Baroness Brinton.
My Lords, the Government's initial response welcoming Dame Carol Black's review to create a cross-departmental approach to tackling drugs misuse and related harm is welcomed, but it has not responded to many of the key recommendations, of which the most important is the introduction of a multi-year ring-fenced funding for treatment services distributed by local need, with at least £552 million invested in the treatment system annually by the end of year 5. So can the Minister say when the Government's full response will be published, and if Dame Carol's recommendations will be fully funded?
The Government has committed to giving a full response to Dame Carol Black's review by the end of the year. And since then, the Government has taken action. Since Part 1 of Dame Carol Black's review, the Government has announced £148 million of investment to tackle drugs misuse, supply and county lines activity. That also includes £80 million for drug treatment and recovery services.
Kingsclere.
So will my noble friend, the Minister, consider the third option not raised by my noble friend Lord Moylan, namely a partial decriminalisation? The evidence from those European countries and indeed those US states that have pursued this course is that not only does it relieve pressure on the police, the criminal justice system and indeed the taxpayer, but it leads to a decline in the number of drugs-related deaths. I appreciate that this is a complex issue with strong views on all sides, so perhaps my noble friend the Minister will consider a temporary experimental change in the laws, as Parliament did over changing our time zone, where we lift the restrictions for a year, and then at the end of that we have a vote.
Well, can I thank my noble friend for reminding us of the third option, or the third way, as some might say. I think it's really important that we do consider all views, and I have read over the years many arguments in favour of liberalisation, but at the same time I've also read many criticisms from drug treatment charities who say it's not as simple as that. At this point, the Government is not committed to any trials on the basis suggested.
Can I refer the Noble Lord the Minister to where Dame Carol Black says, no longer as a society can we turn a blind eye to recreational drug use. Would the Honourable Minister, the Noble Lord the Minister, to make it very clear that the downgrading of cannabis, the delegalisation, making cannabis legal, is sending out a message that it is fine. And it is not fine for those millions of young people all over the country who get caught up with cannabis. It's a gateway drug. The government should not be doing anything like Lord Hannan has suggested.
Well, can I thank the Noble Baroness for her question and the point that is important that we continue to invest in drug treatment services, but also to make sure that we stop drug users actually engaging with drugs in the first place.
Ms Merrin.
My Lords, amongst some 32 recommendations, Dame Carroll stressed the importance of getting more people into treatment who require it, diverting people away from the criminal justice system and ensuring service users are given a wider package of support for housing, employment and mental health. With drug-related deaths in England and Wales rising for the 8th year in a row in 2020, what conclusions might be drawn about the effectiveness or otherwise of the current cross-government approach to tackle addiction? And can the Noble Lord the Minister assure the House that wisdom will prevail and funding for substantive health support services to tackle addiction, that they will be announced in the Comprehensive Spending Review?
Well, the Government has committed to answer in full the recommendations of Dame Carol Black in her review. I mean, in terms of joined-up thinking across government, the Government established a new Joint Combating Drugs Unit, JCDU, in July 2021 to coordinate and drive a genuinely cross-government approach to drug policy. Now, the JCDU brings together different government departments, including those that the Noble Baroness mentioned, the Department of Health and Social Care, the Home Office, the Ministry of Housing, Communities and Local Government, the Department for Works and Pensions, the Department for Education and Ministry of Justice, to help tackle drugs misuse across society by adopting a cross-government approach.
Can I ask about the workforce? The drug treatment and recovery workforce has deteriorated in quantity, quality and morale in recent years, with excessive caseloads and decreased training and lack of clinical supervision. So how does the government plan to increase the number of professionally qualified drug treatment staff and improve occupational standards and training requirements?
The Government hopes to answer will answer all the recommendations in Dame Carol Black's review by the end of the year. But in response to the specific question by the Noble Baroness, I shall commit to write to her.
Ms Jones of Millscombe.
It's hard to legislate to prevent drug use when it is such big business for organised crime globally. Plus, many equatorial countries actually destroy their rainforests so that they can grow drugs because it's part of their economy. So is the government actually looking at these two things, global organised crime syndicates and, of course, environmental devastation from drug growth?
I think the Noble Baroness raises a very important point in that we should look at this more globally, and it's not just to look at our country and the drug strategy in isolation. The Government and various departments is looking and working with partners across the world, but I will write to the Noble Baroness in more detail.
Bill Cox of Newport.
The recurring themes in the report around the importance of holistic care, supporting individuals who use drugs with their health and well-being, their housing needs and opportunities for education, training and employment are indeed very pleasing. It's also good there's been testimony in the report from people with lived experience who can help to shape the support needed. So, building on the question from Lord McConnell, my noble friend Lord McConnell, can the Minister explain how there will be a commitment to essential funding to put many of these excellent recommendations into practice, both in the UK and in the devolved governments?
The Government will respond to the Dame Carol Black's review by the end of the year, and that includes how much funding will be committed. But the Government is committed to looking at the distinct proposals in the review and to see how much resources will be needed and to make that bid.
We as a family have experienced the state of mental health services last 6 weeks, and I had the privilege with meeting numerous inpatients and anguished, distraught parents of young people with drug-induced psychosis, being looked after by the least trained and well-equipped staff often in the absence of staff, doctors and nurses, adequate numbers of doctors and nurses in the ward as well as in the community. In welcoming my noble friend to his role, is he satisfied to respond to Dame Carol Black's request and call for 500 million for drug services? Will he argue for that and do his best to ensure that that is available to all those who need it? And will he agree to meet some of us to discuss this?
Can I thank the Noble Baroness for her question? We have known each other for a number of years, and I've always admired the work the Noble Baroness has done in local communities in Tower Hamlets. In response to the specific question, I will commit to meet the Noble Baroness and others who want to discuss this in more detail. But in terms of the specific response, we have to wait until the end of the year for the government's response to Dame Carol Black's review.